Hello everyone, welcome you all to another video on swelling. I am Dr. Anuj Dash, a general and laparoscopic surgeon. I have discussed previously about the inspection of a swelling. Today, we will learn about the palpation of a swelling, the clinical methods which are needed to palpate a swelling. So let's begin. The disclaimer as usual. Okay. Before starting palpation or before placing your hand over the patient, you need to ask again that whether there is any pain or not. The question you have asked in your history session also. But after completion of your inspection, when you will put your hand over the patient, ask that whether he or she is having any pain over that swelling. যেমন আমরা একটা সোয়েলিং বা হার্নিয়া এক্সামিন করতে গেলাম, ইন্সপেকশনে জিজ্ঞাসা করেছি যে হ্যাঁ, বা হিস্ট্রিতে জিজ্ঞাসা করেছি যে কোনো ব্যথা আছে কিনা আপনার। আবার যখন ইন্সপেকশন শেষ করলাম, আমি পালপেশন শুরু করব, তখন আমাকে আবার জিজ্ঞাসা করতে হবে যে বাবা আপনার এই জায়গাতে কোনো সমস্যা আছে কিনা বা কোনো ব্যথা আছে কিনা। ক্লিয়ার? ইট ইজ ম্যান্ডেটরি। ওকে। Then the examiner will have a close look at you. Okay. So the examiner or your teachers are teaching you for 3 or more years, long time. So he needs to assess your clinical ornamentarium, that whether his teaching was fruitful or not. যে উনি কি শিখিয়েছেন আর তুমি কি শিখেছো এটা তো তাকে দেখতে হবে, এবং দ্যাটস দ্য অনলি এরিয়া হোয়ার এভরিথিং উইল, যে তুমি কি শিখছিলা কিনা, তুমি ক্লাস করছিলা কিনা, তুমি ওয়ার্ডে ঠিক মতো আসছো কিনা, পেশেন্টের গায়ে হাত দিছো কিনা, সবকিছুই কিন্তু জলবত্তরলং হয়ে যাবে। ঠিক আছে? সো when you are examining the patient, your examiner will have a close look at you. Okay? And another most important thing, that method is more important than actual result. পরীক্ষার আগের দিন আমরা খুঁজে থাকি যে হ্যাঁ পরের দিন আমাদের শর্ট কেসটা কোনটা কোনটা দিছে। ঠিক আছে? হ্যাঁ, এটা কি সেবাসিয়াস সিস্ট নাকি এটা লাইপোমা নাকি এটা ফাইব্রোমা, এটা নিয়ে আমরা খুব টেনশনে থাকি। বাট পরীক্ষার হলে কিন্তু এটা নিয়ে স্যাররা খুব একটা মাথা ব্যথা করেন না। তোমার ডায়াগনোসিস ভুল হইলো কিনা আর ঠিক হলো, এটার থেকেও বেশি ইম্পর্টেন্ট হলো তুমি যে এক্সামিনেশন করেছো, যে টেকনিকে, যে মেথডে, সেই মেথডটা কি ঠিক আছে কিনা, অ্যাপ্রোপ্রিয়েট মেথড তুমি কি ফলো করেছো কিনা। ইফ ইউ ডোন্ট ফলো দ্যাট, if your examinations are not accurate but your final diagnosis is right, you may get failed. Like you have demonstrated that the swelling is very much soft. Okay, the swelling slips, the swelling is not fixed to the skin, but you have you have diagnosis, you told that this is sebaceous cyst, so that would it been not right actually. So what you will describe, you have to tell your diagnosis according to your description, according to your examination. So method is very much important than the actual findings. And obviously before starting, don't miss to warm your hands in winter. Not applicable for summer season, but it is necessary to warm your hands in winter. And obviously you have to wash your hands also. Okay? Now, the first thing we assess in palpation, it is the temperature. Okay? And how do we assess this? Actually, we assess with the help of dorsum of my hand. Okay? All the fingers, dorsum. So it is the dorsal surface of your hand by which the temperature is assessed. Why the dorsum is used? Actually, you all know that In a palmar aspect, their skin is thick. Okay, here all the 5 layers of the skin, epidermis, is present. In your dorsal aspect, the skin is thinner, and there are more sensory organs, like for warmth, that is roughness organ, are more present in the dorsum of the hand. So thinner and the more sensory organs, both are responsible. That's why we use our dorsum of your hand to examine to assess the temperature. And obviously with bare hands. In COVID era, gloves are used to be wear by everybody. But if you wear a gloves, mind it that you need to remove prior to assessing the temperature. You cannot assess temperature with the use of glove. So obviously the bare hands. And obviously the comparison. And the comparison, you can do it opposite side or in the forehead or in the surrounding area. Like for example, you're going to examine there is a lump in the right groin. Okay, this is the right groin. So there is also a left groin. Okay. So that is one area, and that is another area. So in bilateral symmetrical, like parotid, like breast, like groin, in bilateral symmetrical organs of area, we will compare with the opposite side. And if the region is not bilateral symmetrical, we can we can compare with the surrounding area. Like if it is not bilateral symmetrical, we can assess or compare with the surrounding area. Clear? Okay, I think clear. And while we need to compare, the thing is, we need to remember, we first put our dorsum in the normal area, then over the swelling, and again over the normal area. Okay, so this is left groin and that is right groin. Okay, so that is abnormal or swelling area and that is normal area. Clear? So first of all, I will put my dorsum over that here normal, that again here abnormal, that again here normal. So the thing is, the normal, abnormal, then again normal. Clear? I think all are clear. After assessing that, in case of a large swelling, we have to assess at multiple points. So put your dorsum of your right hand or left hand over multiple areas, points. Okay. There is a question that how will assess the temperature in peripheral occlusive disease? Okay. So for example, in peripheral occlusive disease, the region is cooler. As the artery supply diminishes, both the limbs or the affected limb will be cooler. So if you just start assessing, that may give a false impression. That's why while we assess a peripheral occlusive disease limb, it's told that the limb should be open for at least 10 minutes. Okay, so after you need to maintain that thing. Okay, how long to place hand? There we will put our dorsum for how long. Actually, there is no time limit. It depends on your practice. Actually, if you practice more, then that time limit will be okay. Now, interpretation. Actually, if you find the temperature is normal, there is nothing normal in case of temperature. That is told that this is not raised. We don't use normal to describe a normal temperature. We rather told that the temperature is not raised. Clear? So in most of the swelling, the temperature will be not raised. Clear? And if I found the temperature raised, it indicates that swelling may be inflammatory. Any inflammation is there because inflammation has got some features, and one is heat. Temperature will be raised. And the vascular swelling, which is especially the arterial, through artery blood flows. So the vascular swelling, in case of vascular swelling, the temperature can get raised also. And in case of occlusive disease or ischemic limb, the temperature will decrease. So temperature impression is, in case of normal temperature, that will be not raised, and other is raised or decreased. Clear? After the assessing the temperature, next is tenderness. Okay, and look at the picture. I am examining with the now palmar aspect, palm of all my fingers, and putting in the right groin or the swelling area, and I am looking toward the patient's eye. Okay, so there is a saying that it is the facial expression which never lies. Like there is a swelling. I have started to examine the for the tenderness. So I am telling that, okay, আপনাকে I am pressing over it and asking that you are getting any pain. অথবা মনে করো যে আমরা একটা চাকা দেখতেছি, সুইলিং দেখতেছি, আমি চাকার উপর চাপ দিচ্ছি, দিয়ে বলতেছি যে বাবা আপনার কি ব্যথা করতেছে? So that would be wrong. You need not to ask anything. Okay, it is the facial expression you need to look for. So always mind it that when you will press for tenderness, look at patient's face. Your eye, তুমি কোন দিকে তাকিয়ে আছো সেটা তোমার টিচাররা অবশ্যই খেয়াল করবেন. So that is the important thing. And there is a pressure that how to examine, that is you need to talk with the patient and not talking about the tenderness, যেটা আপনাকে ব্যথা আছে কিনা, অন্য কোনো কথা. Talk not related to the patient tenderness or pain. Then press and then watch. Okay, that is the technique. What amount of pressure need to be given? আমি কতটুকু চাপ দিব? Actually that is moderate amount. জিনিসটা হচ্ছে হলো যে প্রেসার দিলে পরে নর্মালি একজন মানুষ ব্যথা পাবে না, সেই প্রেসারটা দিতে হবে. So moderate amount of pressure is needed to be given. Then we need to assess the size by looking. Okay, and you can measure on palpation that the length, breadth and width with measuring tape. On inspection you have assumed, but on palpation you have to get shear. Okay, that what is the actual length? You may tell that length is 4 cm and breadth is 3 cm, width is 2 cm. Okay, and you need to use a measuring tape for that purpose. Okay, actually as this measurement is cumbersome or sometimes time consuming, sometimes most of the time the teacher say that okay, omit it, go to the next procedure. But if you don't carry a measuring tape, if your teacher sees that, if you don't carry a measuring tape, then that can be a bloomer actually. Because if you carry a measuring tape, mostly your teacher will tell that omit, we go to the next procedure. But if you don't show, then the measurement of size, that will end your examination. So my request is always carry a measuring tape and always try to act that you are measuring the swelling with a measurement tape. Your teacher may not ask you to continue. Okay, then the shape also and number also, you have to tell about the shape and number again on palpation. Now about surface, how would be surface of the swelling. And for assessing the surface, the same thing we need to follow with the, as usual, as the tenderness, that we need to assess the surface with the use of your palmar surface of your hand, the palmar surface. Okay, and another word is gently. The gentleness is very important in your clinical examination, so be gentle always. Okay, Then the surface may be, the findings may be most of the time that is smooth. If the swelling is like in lipoma or in fibroma or near fibroma, most of the swelling surface will be smooth. Sometimes lipoma can be lobulated. We told that lobular. If you find that lobular, that it is lipoma actually. If I find a goiter, that will be nodular. In goiter, there are many more nodules. So that will be a multinodular goiter or something. Clear? Okay. The surface can be anything can be that is bosselated also. And a boss means a protuberant area. What is boss? That means in case of that kidney, there are lots of swelling, small swellings, and in the surface is protruded with the small swellings. So it is bosselated. And sometimes we call surface variegated. If you cannot determine the surface in metal, that variegated, various, the বিভিন্ন রকমের surface. And if we cannot define that is regular or irregular, you can tell it is irregular surface. So surface can be defined or described with these nominators. Now after surface, that is margin. We examine surface with all our palm, but you need to use only your fingertip. That is the fingertip. That fingertip we need to use to examine the margin. So we will encircle the swelling with using our fingertip of index finger usually to examine the margin. Clear? And that can be defined by described as well defined. And that well defined margin, it can be regular or even it can be irregular. Actually, it's in irregular, it is found that mostly it is malignant swellings, and regular swellings mostly are benign swelling. Or like that swelling that is regular. Okay, the surface is margin is surface is smooth and the margin is regular. Okay, it is lipoma, I think, and that is benign swelling. And keloid, it can be well defined margin, but it can be irregular also. And ill defined, usually acute inflammation. Ill defined, that means in acute inflammation there will be swollen. Okay, and that swollen area you cannot measure the margin properly. So that's why the in acute inflammation it will be ill defined, or you can tell it diffuse. So to describe margin, we need to use regular or irregular or well defined or ill defined or diffuse. Now about the consistency. And consistency to assess, it is gentle pressure with thumb board index at multiple points. Like how you assess the tenderness or the surface, in same way you can assess the consistency. Okay. And the consistency are described or compared with some things. Like if you want to tell swelling soft, you need to compare with the lips or your ear lobule. These two things are soft in consistency, lips or ear lobule. Some say the consistency is cystic, but I would request to avoid this because this is a wrong term. Because a cyst means that there is sac which contains fluid inside, and if the fluid is without any tension, that will be soft in consistency. Or if the fluid is used with a diffuse tension, that will be hard in consistency. Or if the swelling or a fluid has moderate tension, that swelling will be firm. So cystic consistency I don't like actually, and most of the teachers don't like to say that the cystic swelling. Then the swelling can be firm, and it is compared with the tip of your nose or the pinna. And the swelling can be hard. Hard, that means bones, the forehead or masted process. These are the subcutaneous bones. So that's why with those two bones we can compare it is hard or not. And the hard consistency, that can be stony hard or woody hard. And also you can tell in consistency also it is variegated consistency. Okay, what will you do if you tell that the swelling is soft, sir. If you found that swelling is soft, you need to examine the following things. Like if you have to examine for sign of indentation for sebaceous cyst or dermoid cyst, sleeping sign for lipoma, compressibility for hemangioma, fluctuation test. If you find that there is a swelling, it has got some fluid, fluctuation test, and transillumination test that will dictate that the swelling is having clear fluid. So if you found anything soft swelling, you need to examine these 5 things. Clear? And it should be one by one, sequentially. Okay. That things will be described in my next video in details. And if you found any swelling, if hard, far more hard, if you describe that the swelling is far more hard, you need to examine these things. You need not to examine these things. Okay. Rather, you will go for examining the draining lymph node of that swelling. The draining lymph node examination. If you find that the swelling is firm or hard, then we will go for the mobility. The swelling is mobile or not, and the fixity. Whether the swelling is fixed with the overlying skin or underlying structure, and if the swelling is pulsatile, we will go for the pulsation. The later ones, the fluctuation, the soft swellings, the transformation test will be described in my next video. I think that you have got the idea that how to palpate a swelling. Okay, I think that is have helped you in any sense. Okay, thank you very much for your patience hearing. I will meet you again. Thank you very much. Thank you.